Psoriasis is a chronic autoimmune condition that affects the skin, causing cells to build up and accumulate rapidly on the surface. In a person without psoriasis, skin cells typically take about a month to grow and shed. But in someone with psoriasis, this process happens in just a few days. The result is a buildup of skin cells that form thick, scaly patches on the skin's surface. These patches, often called plaques, are the hallmark of psoriasis. At its core, psoriasis is a result of the immune system mistakenly attacking healthy skin cells. This leads to the accelerated growth cycle of skin cells, causing them to build up rapidly on the surface of the skin. Psoriasis is a fairly common condition, affecting about 2 to 3% of the world's population. In the United States, it's estimated that about 7.5 million people have psoriasis. It can develop at any age, but it most commonly appears between the ages of 15 and 35. Types of psoriasis. There are several types of psoriasis, each with its own characteristics. Number 1. Plaque psoriasis. This is the most common form of psoriasis, affecting about 80 to 90% of people with the condition. Plaque psoriasis appears as raised, red patches covered with a silvery white buildup of dead skin cells. These plaques can be itchy, sore, and sometimes crack and bleed. Number 2. Guttate psoriasis. This type is characterized by small, drop-shaped lesions. This form often appears suddenly, sometimes after a strep throat infection, and is more common in children and young adults. The lesions are typically smaller than those in plaque psoriasis and often appear on the trunk, arms, and legs. Number 3. Inverse psoriasis. Inverse psoriasis shows up as smooth red patches in body folds, like under the breasts, in the armpits, or the groin area. Because these areas tend to be warm and moist, the patches don't have the typical scale seen in other types of psoriasis. This form can be particularly uncomfortable due to friction and sweating in these areas. Number 4. Pustular psoriasis. This is a rarer form characterized by white, pus-filled blisters surrounded by red skin. It can occur in small areas, like the hands and feet, or cover most of the body in severe cases. When it covers large areas of the body, it's called generalized pustular psoriasis and can be quite serious, sometimes requiring hospitalization. Number 5. Erythrodermic psoriasis. This is the least common type, but can be very severe. It causes widespread fiery redness over most of the body and can cause severe itching and pain. This form can be life-threatening because it can disrupt the body's ability to regulate temperature. Causes of psoriasis. The exact cause of psoriasis isn't fully understood, but we know it involves a combination of genetic and environmental factors. Research has identified several genes associated with psoriasis, suggesting that the tendency to develop the condition can be inherited. However, having these genes doesn't guarantee you'll develop psoriasis. It's estimated that about 10% of people inherit genes that make them susceptible to psoriasis, but only about 2 to 3% actually develop the condition. Environmental factors play a crucial role in triggering psoriasis in those who are genetically predisposed. These triggers can vary from person to person, but common ones include stress, certain medications, infections, especially strep throat, skin injuries, and cold, dry weather. Lifestyle factors like smoking and excessive alcohol consumption may also increase the risk of developing psoriasis or make existing psoriasis worse. At the cellular level, psoriasis involves an overactive immune system. T cells, which are a type of white blood cell that normally protects the body against infection, mistakenly become activated and attack healthy skin cells. This triggers a series of reactions, including the release of inflammatory chemicals called cytokines. These cytokines cause skin cells to multiply much faster than normal and also dilate blood vessels in the skin, leading to the redness seen in psoriasis plaques. Symptoms of psoriasis. The symptoms of psoriasis can vary widely depending on the type and severity of the condition. For those with plaque psoriasis, the most common symptoms are red, raised, inflamed patches of skin covered with silvery scales. These plaques most often appear on the elbows, knees, lower back, and scalp, but they can occur anywhere on the body. People with psoriasis often describe the affected areas as itchy, burning, or sore. The itching can be particularly intense and may interfere with sleep and daily activities. In severe cases, the plaques can crack and bleed, which can be painful and increase the risk of infection. Psoriasis can also affect the nails, causing them to become thick, ridged, or pitted. In some cases, the nails may even separate from the nail bed, a condition called onycholysis. This can be not only uncomfortable, but also embarrassing for those affected. It's important to note that psoriasis is more than just a skin condition. It's a systemic inflammatory disease that can affect other parts of the body as well. About 30% of people with psoriasis develop psoriatic arthritis, which is a form of inflammatory arthritis that causes joint pain, stiffness, and swelling. Psoriasis has also been linked to an increased risk of other health problems, including cardiovascular disease, diabetes, and depression. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of psoriasis. Diagnosing psoriasis typically involves a physical examination and a review of medical history. A dermatologist will look at the affected skin and may ask about family history, recent illnesses, or any medications you're taking. In most cases, the appearance of the skin is enough to make a diagnosis. Sometimes, if the diagnosis isn't clear, a skin biopsy may be necessary. This involves taking a small sample of affected skin and examining it under a microscope. The distinct cellular changes seen in psoriasis can help confirm the diagnosis. There's no single test to diagnose psoriasis, and it can sometimes be confused with other skin conditions like eczema. This is why it's important to see a dermatologist for an accurate diagnosis. Treatment for psoriasis. When it comes to treatment, there's good news and bad news. The bad news is that there's currently no cure for psoriasis. The good news is that there are many effective treatments available to manage the symptoms and improve quality of life. Topical treatments are usually the first line of defense for mild to moderate psoriasis. These include corticosteroid creams and ointments, which can reduce inflammation and slow cell turnover. Other topical treatments include vitamin D analogs, retinoids, and coal tar. These medications can help reduce scaling, itching, and inflammation. For more severe cases, or when psoriasis covers large areas of the body, systemic medications may be necessary. These are drugs that work throughout the body and can be taken orally or by injection. Traditional systemic drugs include methotrexate, cyclosporin, and acitretin. These medications can be very effective, but may also have significant side effects, so they require careful monitoring. In recent years, a new class of drugs called biologics has revolutionized the treatment of moderate to severe psoriasis. These medications target specific parts of the immune system involved in psoriasis. They can be incredibly effective, sometimes clearing psoriasis completely in some patients. However, they're also expensive and can increase the risk of infections. Phototherapy or light therapy is another treatment option. This involves exposing the skin to controlled amounts of natural or artificial ultraviolet light. It can be done in a doctor's office or at home with a special light unit. While effective, it requires a time commitment and can increase the risk of skin cancer with long-term use. Beyond medical treatments, lifestyle changes can play a crucial role in managing psoriasis. Moisturizing regularly is important for everyone with psoriasis. It can help reduce scaling, itching, and inflammation. Some people find that soaking in a warm bath with oil or Epsom salts can help soften scales and ease itching. Many people also find that stress reduction techniques like meditation or yoga can help reduce flare-ups. Maintaining a healthy weight, eating a balanced diet, and avoiding triggers like alcohol and smoking can also make a big difference. Now, we want to hear from you. Do you or someone you know have psoriasis? What treatments worked for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.